Hello, everyone. Welcome to our presentation on the impact of geography on opioid overdose mortality trends by racial groups. My name is Navneeth, and I'm joined today by Amogh and Rionna. Special thanks to our mentors, Annabelle Chen and Dr. Gross, as well as our fellow Alice Guan. The opioid epidemic is a critical public health crisis with consequences affecting communities worldwide, with limited data available. Our goal in this project was to investigate the relationship between distance traveled and racial groups, as well as urbanicity and overdose intent. We define distance traveled as the distance between the location of residence and the location of death. Our study design was an observational cross-sectional study. We included participants based on the International Classification of Diseases, 10th edition, ICD-10. We classified overdoses by either accidental, intentional self-harm, assault, or overdoses of undetermined intent.
We used the NVSS data from 2016 to 2020 for our dataset. Decedent data was identified by race, cause of death, and various other factors. Our methods include calculating the distance traveled by decedents using county centroids, the average distance traveled across races, the rate of opioid overdose due to suicide, and the proportion of opioid overdose in urbanicity. We found that distance traveled was a more appropriate measure of opioid overdose based on previous literature.
Looking at our results, in Figure 1, we see that opioid overdose deaths occur much more often than we expect, basing this off of urbanicity in a given state. For example, Alaska and North Dakota saw much more opioid overdose deaths than expected based on their respective urbanicity. Knowing this, we looked at how far decedents travel and disaggregated by race, which is present in Figure 2. We saw that Asian and Pacific Islanders show the highest average distance traveled amongst the racial groups, and these results stayed consistent across all 5 years that we studied. From these results, we decided to study intent, specifically self-harm or suicide, which is shown in Figure 3. We found that suicide rates were significantly higher amongst Asian and Pacific Islanders than the other race groups, and these findings were consistent across all 5 years.
After analyzing our data, we found that targeted outreach and intervention is required to address unique challenges faced by Asian and Pacific Islanders in opioid overdose prevention. Varied access to harm reduction tools also highlights the necessity for tailored outreach campaigns and equitable distribution of life-saving resources, especially in urban areas. And finally, for our future work, we intend to investigate the co-use of opioids with other substances to gain a comprehensive understanding of polydrug interactions that may contribute to overdose risk.